Hi, my name is Jaclyn Youngkin. I'm going to be doing your head-to-toe assessment today. Can you tell me your name?
Dennis.
And where are you located right now?
The hospital.
And can you tell me your date of birth?
May 14th, 1971.
And can you tell me today's date?
September 2nd.
Good. Are you having any pain today?
Only in my right knee.
Did you injure it recently?
Yes, I had surgery 2 weeks ago.
What type of surgery did you have?
Torn meniscus.
Okay. On a scale of 0 to 10, if 10 is the worst, how would you rate your pain?
5.
Okay, great. Can you tell me how much you weigh?
185.
And how tall are you?
5'9".
Great. I'm going to be starting by taking your vital signs. Good. Your blood pressure is 120/80, heart rate is 66, and you have a respiratory rate of 16. I'm going to be starting by just looking over your skin to see if you have any abnormal areas or lesions. Your skin is nice and pink, warm and dry to the touch. Just going to check your turgor. Good response. Good. No signs of dehydration. Checking your capillary refill. It's nice and brisk at less than 2 seconds. Your fingernails show no signs of clubbing either, which is good. I'm going to take a look at your legs here. Your legs are also nice, pink, dry, warm to the touch. I see that you have 3 points from your incision for your surgery here. All of them seem to be nicely approximated. I see you also have on the lateral aspect of your knee an abrasion. What happened there?
Tore it on the reef, spearfishing.
Okay. It seems to be healing nicely. There's no signs of infection. So just keep an eye on it in case you do start to see any changes there. There's no gross abnormalities noted to your legs or to your feet as well. I'm just going to look at your scalp here and palpate it and check the skin. There's no gross abnormalities noted to the bony structure or to the skin. You can look at me. Just going to look at your sclera. They're nice and white. Your conjunctiva are nice and pink. Can you open and close your mouth? Again? Good. I'm just feeling your temporomandibular joint. Was there any pain there when you were opening it?
No.
Good. I didn't feel any clicking either. Just feeling for cervical lymph nodes, which I don't feel any. I'm just going to feel your temporal arteries. Good. There's no abnormal pulsations noted there. I'm going to check your facial nerve, which is cranial nerve number 7. Can you smile for me? Good. And puff out your cheeks. Good. Can you move your jaw from side to side? Good. That's also innervated through cranial nerve number 5. I'm just going to check your sinuses by pressing. Do you have any pain when I press?
No.
Good. Okay, next we'll be checking cranial nerve 2, 3, 4, and 6, which are the optic, the ocular motor, the trochlear, and also the abducens. We're going to be checking your pupils to make sure that they respond equally to light, and also to make sure that your muscles of your eyes are working properly. I'm going to shine a light into your eyes to make sure they respond. Good. You have direct and consensual response, which is what we want. Look straight at my pen light and keep your head straight, but follow it with your eyes wherever it goes. Good. You had good convergence, and you were tested positive for all of your cardinal positions repeating. Your pupils were also round, equal, and responsive to light the way that they should be. Next, we're going to check, before we do that, if we had an ophthalmoscope, we could also check for the corneal light reflex and also the internal structures of all the eyes. But we'll move on to your ears. If we had an otoscope, we'd be looking inside to look at the eardrum as well and some of the internal structures to make sure that there aren't any signs of infection or a perforated eardrum. I'm just going to be looking inside today, pulling gently back on the ear. Do you have any pain or tenderness?
No.
Good. And you don't have any signs of drainage or infection noted. We're going to be testing cranial nerve number 8, which is the vestibulocochlear nerve, by doing the voice test. I'm going to cover one ear and whisper a word to you if you can repeat it back to me, whatever you hear, okay?
Apple. Baseball.
Good job. I'm just going to look at the structure of your nose here. Good. No deformities are noted. We're going to look at the mucosal lining. Good. Nice pink and moist. We're going to look at your mouth. If you can open up for me. Good. No deformities noted to the dental structures. Your gums look healthy. Your buccal mucosa is nice and pink and moist as well. Your uvula is midline. Can you stick your tongue out and say ah?
Ah.
Good. Your tongue is also midline. We're going to check your olfactory nerve, which is cranial nerve number 1. If you can close one side of your nose with your finger and breathe in. Good. And do the opposite. Good. You seem to be breathing equally through both sides. Is that correct?
Yes.
Good. Have you noticed that you've had any issues with smelling anything recently?
No.
Good. Just going to take one more peek in to see your tonsils. Have you ever had them removed?
No.
Good. There's no inflammation noted. By checking in your mouth and having you say ah and making sure that your uvula and your tongue are midline, we've also checked the glossopharyngeal, the vagus, and your hypoglossal cranial nerves. Okay. I'm going to move on to your neck. Just going to palpate your muscles. There's good symmetry. There's no lumps. I'm going to feel for your carotid artery. Good. Good carotid pulse. I'm going to listen for a bruit. I did not feel any thrills. Just going to feel your trachea. It's nice and midline. I'm going to come behind you. I'm going to feel for your thyroid gland. I would like for you to swallow. And one more time. Good. No abnormalities are noted there. I'm going to do some range of motion with your neck to make sure that you're doing okay in that department. If you can put your ear to your shoulder for me. Good. And the other side. Good. And make a big circle around with your neck. Good. Now we're going to test some strength. I'm going to push on one side of your face. I would like for you not to allow me to move your head, okay? And one more. Good. Equal strength. The last thing we're going to check in this area is cranial nerve number 11, which is the accessory nerve. Can you shrug your shoulders up and down for me? Good. All right, perfect. We're going to move on to your chest and your lungs. I've already inspected your skin and everything looks good. There's no lesions noted. Just going to palpate your thoracic area. Good. Is that painful at all?
No.
Okay. We're going to do a test called tactile fremitus. When I touch your chest, I'd like you to say the word 99.
99, 99, 99, 99, 99, 99.
Good. Nice and equal on both sides. I'm going to come behind you, lean forward a little bit. I'm just going to check for symmetric movement and expansion of your lungs. Go ahead, take a deep breath. Good. Nice and symmetrical. You can turn a little bit to your side here. I'm going to percuss your lung fields. And percuss the bases of your lungs. Good. I can also feel that the spinal processes are nice and in alignment. No protrusions noted. I'm going to take a quick listen and auscultate your lung fields. Turn to the side for me. Good. Take a deep breath in. Good. And again. Good. All lung fields anteriorly and posteriorly are clear. Just going to look at your precordial area. Again, I don't feel any pulses or thrills. I'm going to auscultate the area. And the point of maximal impulse. Your apical rate is regular. You can hear S1 and S2 clearly. There's no extraneous sounds, no murmurs. Okay. Next, we're going to do range of motion of your upper extremities. If you can lift your arm straight up in the air, all the way up, and back down, and out to the side. Go ahead, now across your body. Go ahead and do the same with the other arm, all the way up, back down, up to the side, and across your body. Good. We're going to check your wrist. Can you flex your hand down and flex it up? And same with the other arm. Down and up. And spread your fingers nice and wide. Good. We're going to check the strength in your fingers. Good. I'm going to push down on your wrist. Don't let me, okay? Good. And then push up. Okay. And put your arms out this direction. I'm going to push down. And up. And in. And out. Good strength bilaterally. you can go ahead and lay down on the bed for me. We're going to move on to your neck and abdomen. First thing we're going to check for is your jugular vein. If you can turn your head towards the wall for me, I'm just going to inspect and find the pulsation, which is clear to be right here for him. I'm just going to palpate it lightly. Good pulse, no thrills. I'm going to auscultate with the bell of my stethoscope. Good. And there's no bruit noted either. You have no jugular venous distension, which is good for you. Okay. You can put your head wherever you're comfortable. I'm just going to move along to your abdomen and inspect your abdomen. There doesn't seem to be any gross abnormalities. Again, your skin is nice and warm to the touch and dry. I'm going to auscultate your lung sound, your abdomen sounds real quick. Your bowel sounds. Good, nice and active in all four quadrants. I'm just going to palpate the area. Any pain or tenderness?
No.
Good. I'm going to listen to your vascular sounds, starting with your aorta. Moving down to the iliac arteries. And the renal arteries. And down to your femoral arteries. Good. No bruise noted there either. I'm going to palpate your aorta. Good. I'm going to palpate for your kidneys. Good. I'm just going to percuss your abdomen. Good. And I'm going to percuss your liver border. Feel for your liver. And also for your spleen. Good. I'm going to check your femoral artery for pulse. Good. Your femoral artery is +2 and equal on both sides. You don't seem to have any swollen inguinal nodes. I'm going to move down to your lower extremities. We're just going to do a little bit of range of motion while we're here. Can you lift your knee up? Good. Now straighten your leg. Lift this knee up. And straighten it back down. Okay. Are you able to bring your leg, lay on your side for me? Good. And can you lift this leg up in the air? Good. We're just checking your hip. Good. Lay on your belly. We're going to do some extension. Lift your leg up in the air. Keep your leg straight. Keep your leg straight, please. And now lift your leg up. Good. And back down. We're going to do it with this leg as well. Up and back down. Good. You can go ahead and roll over on your back. And again, your skin, there's no abnormalities other than your incision points on your right knee. Your bony structures are normal. Your capillary refill on your toes is brisk. We're going to check for your popliteal pulse while we're here. If you can bend your leg up a little for me. Good. And on the other side. Good. Nice and equal. You have equal hair distribution on your legs as well, all the way down to your toes, which means you've got great peripheral vasculature. You can go ahead and sit up for me on the side of the bed. Okay. Again, we're just going to check, do some range of motion. We're going to do it in your ankles this time. If you can flex your foot up and point it back down. Good. And can you turn it in medially and out? Good. And with this side, flex your foot up and down and turn it into the middle and out laterally. Good. I'm going to do some strength exercises as well. Push down on my feet. On my hands. Good. And I'm going to push it. There you go. Good. Okay. I'm going to check the remaining pulses, your posterior tibial. Your dorsalis pedis. Good. And again, your posterior tibial. Your dorsalis pedis. And all your pulses are +2 and equal bilaterally. Your temperature is equal on both sides, nice and warm and dry. And you don't seem to have any noted edema as well, which is good. The bony structures of your ankle and your feet are in good shape. We're going to start to move on. We're going to have you stand up and we're going to do some neurologic and sensory testing next. We're going to do a test called the Romberg test. If you can lift your arms up out in front of you, palms up, and close your eyes. Good, and there's no swaying noted or loss of balance. And you can see that he brought his arms right back up to the same position. Good, you can lower your arms and open your eyes. You can sit down. I'm going to check what's called a Babinski reflex. I'm going to have you take your flip-flop off. And you can see that there was flexion of the foot, which is what we expect. I'm going to use an object and it's got a sharp side and a dull side. And I'd like to tell you to tell me if it's sharp or dull when you get poked with it, okay?
Sharp. Sharp. Dull. Dull.
Now I'm going to touch you on either side of your body or both, and I'd like you to tell me what you feel, okay? This is something called extinction.
1.
Which side?
Left. Right. Both.
Good.
Left. Right. Both.
Good. We're going to check the sharp and dullness again on your legs, okay?
Sharp. Sharp.
And now on your arms.
Dull. Dull.
Good job. You can keep your eyes closed for me 1 more minute. I'm going to hand you a regular household item, and I'd like you to feel it and tell me what it is without looking.
Paperclip.
Good job. You can open your eyes. Okay. I'm going to check some of your cerebellar functions. I'm going to hold my finger up, and I'd like you to use your finger to touch my finger and then back to your nose. Good job. All right. We're going to test some of your deep tendon reflexes. I'm going to check it bilaterally. The only one that I won't will be to your right knee since you just had your recent surgery, okay? I'm going to check your triceps. Good reflex. And again on this side. Good reflex. We're going to do your biceps. Good. You saw a little jump to the hand. We're going to move down to the brachioradialis. You saw the fingers twitch a little bit, and we're going to do your radial. And the thumb twitched a little bit. Again, on this side. Good response. Brachioradialis, and back down to the radial. And the thumb twitched. We're going to move down to the knees. Again, I'll skip your right knee. We're going to do the patellar. And you not have pressure on your leg. There you go. Good response. And we're going to do your Achilles. There we go. And again on this side. Achilles. Good. And you can see the twitch to the foot. I'm going to have you stand up now, and I'm going to have you walk a little bit. I'd like you to walk across the room, touching your toe to your heel. Good, and come on back, and walk on your heels for me. Good job. Now stand up and do a shallow knee bend. Good. Bend over and touch your toes. Good. I'm just going to check your spinal processes again. Good. And no abnormalities noted. Go ahead and stand up. You got a good S curve to your spine. Can you lean to the side for me? And to the other side. And lean back. Good. You've got good flexibility in your spine as well. Okay, you can go ahead and sit down. Is there any questions that you have for me today?
No.
Okay. My only recommendation would be to follow up with your surgeon to make sure that you regain full use of that knee and full mobility, okay? And that you don't have any issues.
All right, thank you.
All right, thank you for allowing me to assess you today.